I've always believed that your happiness is a reflection of your health. If you want to be happy, then you must first take good care of your body. And a lot of times, we fail to take good care of ourselves, not because of paucity of time or ignorance, but because of lack of knowledge or non-availability of information. And thus, in today's Aster Love Yourself to Live Healthy segment, I'm going to talk of an issue that needs awareness, and that is cervical cancer. Cervical cancer is the fourth most common form of cancer in women, with millions of new cases being diagnosed across the world every year. I spoke to Dr. Swati, leading gynecologist from Aster Clinics and Hospitals, to know more about this disease and the remedies available. Doctor, welcome on the Uma Show.
Thank you, Uma.
To start with, what is cervical cancer?
Okay, let me tell you what is the cervix. Cervix is a connecting organ between the uterus and vagina. So the cancer arising in the cervix tissue is called cervical cancer. It is the third most common cancer amongst the women.
Okay.
But it is very slow growing cancer. They may not know that they are carrying abnormal cervical cells. We call it as precancerous lesions, which if not detected early and not treated, they go into the cancer stage.
What are the causes of cervical cancer?
Uma, most of these cervical cancers, they are caused by a HPV infection.
Okay.
HPV is a human papilloma virus infection, which is transmitted from one person to another person through the sexual contact or skin-to-skin contact. It is so common that almost all women, they get this kind of infection at some point in their life.
Okay.
But our body immunity will clear that infection within 6 months to 2 years. But if that infection persists in body for longer duration, it will lead to the precancerous lesion, and if they are not detected on time and not treated, they will go into the cervical cancer stage.
What are the symptoms? How do we know we have it?
As I told you that most of the time they are asymptomatic, but sometimes patient may come up with menstrual abnormalities like heavy menstrual flow or frequent menstruation. Even if you are not having symptoms, you should be doing the screening test to detect the precancerous lesions, because they may be asymptomatic, not having any issues, but still they are carrying the abnormal cells, which in long run can lead to the cervical cancer.
So doctor, how do we prevent it?
To prevent this thing, there are two things to keep in mind. One, we have got a vaccination to prevent this HPV virus infection.
Oh, really?
This vaccine can be given at the age of 11 years and onwards up to the age of 45. There are 3 doses to be taken at 0, 1 and 6 months. But even if you take vaccine, you need to go regular health checkup or the screening test. The screening test is called a pap smear test, which one person should, every woman should undergo it every 3 years if it is normal. This is a very simple procedure when we do it in the clinics. The cells are taken with the brush and they are examined under the microscope. Along with the pap smear, we may do the HPV DNA detection test also. If both these tests are normal, then she has to undergo further checkup after 3 years.
Interesting. And so as you said earlier, that we need to check ourselves on a regular basis to make sure that it's not there.
Sure.
How do we treat the precancerous lesions?
If we detect these abnormal cells on the pap smear test, then the patient is subjected to the further test called colposcopy, in which the cervix is examined under the magnification, and any abnormal cervical tissue is biopsied and then examined further. The treatment can be done at the same sitting, either with the laser therapy, cryotherapy, or it can be planned in the second sitting. But it can be treated completely, and we need to follow up these patients after 6 months, doing again the pap smear and that HPV DNA test to see that women is cleared of everything.
How common is it in this region or around the world?
In developed countries, the incidence has gone down because of this detection, screening detection and HPV test, because of the vaccination as well. But in most of this, 80% of the cervical cancers, they are happening in the developing countries where women, they don't have access to the screening test and vaccination.
Any lifestyle changes we can bring about to prevent it?
Yes, of course, lifestyle modification is important, meaning maintaining the hygiene, monogamous relationship, using barrier precautions, And taking balanced diet and regular exercise, these things also can help to prevent the cervical cancer.
Thank you so much, doctor. I think it's very interesting what you spoke about and great information for all of us women.
Thank you so much. Pleasure.